Hello, welcome to Wellness Wednesday with Maple Tree Cancer Alliance. Whether you're newly diagnosed, undergoing treatment, or in recovery, this conversation is for you. My name's Ariel, an exercise oncology educator, and today's conversation is on sexual wellness after a cancer diagnosis. Following our conversation, stick around for some gentle movement. The information in this video is for educational purposes only, so it's important that you consult with your medical care team for more in-depth guidance and advice. Let's get started. Did you know? Studies show that sex, sexuality, and intimacy are just as important to people who have cancer as they are to people who don't. Sex and intimacy can help you deal with the emotions that come from having cancer and getting treatment. The treatment can affect every part of your sexuality, including your sex organs, sexual desire, sexual function, and well-being, along with body image. Sexual wellness is not talked about enough, so I wanted to provide you with some questions that you can ask your healthcare team. The first one is, what changes in my sexual functioning should I expect? This is important to ask because it can open up the doors for honest conversations and be proactive with your care team and to help you understand and prepare for potential changes in sexual health during and after treatment. The next question is it safe for me to have sex? This is an important question because your safety is the primary concern both physically and medically, especially during periods of immunosuppression or healing. Will my cancer or treatment affect my fertility? This is an important question for women who want to have biological children. The fertility preservation is a time-sensitive issue, and this allows early understanding and time to consider options before starting treatment. What are my options to prevent or prepare for sexual health concerns? This can empower you to be proactive about maintaining sexual health and quality of life during treatment. And who else do I talk about this to? This can connect you with the right experts for support beyond your medical team. It also it can reassure you that you're not alone and that there is help available for sexual health and emotional concerns. Sexual side effects of cancer and its treatments. Women treated for cervical and gynecological cancers may experience vaginal dryness, pain during sex, or vaginal narrowing. Breast cancer patients may also face dryness, low libido, difficulty orgasming due to hormone therapy affecting estrogen and androgen levels. Both men and women face body image issues. They may experience weight gain, hair loss, or bladder issues, which can affect self-image, energy, and libido. Treatments such as surgery, for example, a mastectomy, and then reconstruction, changes appearance and can reduce sensations, leading to feelings of being less sexually active. And it's normal to feel down as your body changes during treatment. Fertility issues, treatments like radiation, chemo, and surgery affect fertility by altering the hormones, your sperm, and the eggs. And the impact varies by treatment type, dose, age, genetics, among other things. And while fertility doesn't directly affect sex or sexual wellness, it can influence intimacy, self-esteem, and sexual desire. And for men, the most common side effect is erectile dysfunction, loss of sexual activity, and alteration in orgasm or difficulty reaching that orgasm. And here are some support care services that I think are important to look into. The first one is a sex therapist. This is a licensed professional who helps address emotional, psychological, and relationship issues related to sexuality. A pelvic floor therapist is a specialist who can treat pain, tightness, or dysfunction affecting sexual activity. A fertility specialist, they can offer guidance on fertility preservation and reproductive options. Support groups can offer, whether that be peer support, shared experiences. This can normalize concerns and reduce isolation. An oncology social worker or counselor, they are super important. They can provide emotional support, coping strategies related to body image, intimacy, and sexual identity. And the last one is a nurse navigator. These are nurses who are within the hospital on your care team, and they can help coordinate referrals and provide education on managing sexual side effects. Thank you so much for being a part of our conversation today on sexual wellness after a cancer diagnosis. I hope the information we've covered has brought you some clarity and comfort. Your health and well-being are what matters most, so please continue to take care of yourself, stay informed, and remember that hope is always present. Now let's transition into some gentle movement to further support your journey.
Hi, my name is Allie, your exercise oncology instructor with Maple Tree Cancer Alliance. Welcome to week 7 of our 12-week moderate intensity strength training program. Today, we will be focusing on alternating and lateral movement patterns. You will need a floor space and a pair of lightweight dumbbells. The following exercises are meant to be pain-free. If you experience any pain from these movements, please skip the movement or stay in your pain-free range of motion. Let's get started. All right, so we'll begin our warm-up today. We'll start with an overhead reach, so just feet about shoulder width apart. Reach your hands all the way up to the ceiling. Stretch it all through your back, and then you can lean to the side. Hold it here. Switch to the other side. And then you can take it down to the middle for a fold. Feel it in your hamstrings. As low as you can get while keeping your legs straight. Hold it here for a second, and then we'll slowly roll it up. We'll go into a good morning stretch, so you can do your feet just a little wider than your shoulders, back straight, and you're just gonna lean forward, hinging your hips back. Your back is flat, feeling this still in our hamstrings. And once you get to about 90 degrees bent over, it will stay here. Feel it in those hammies. And then slowly stand it up straight. And we'll do it again. Remember, your back's still straight. Just your hips go back. The rest of your body follows. And stay here. Just another couple seconds. And then we'll bring it up. We'll go into our wide leg stance. Arms to the ceiling again. Lean it backwards, and then when you're ready, fold it down towards the floor. Hang out here for a while, however you're comfortable. And just stay here another second, and then slowly roll it up so you don't get dizzy. And then we'll do our shallow lunges, still in that wide stance. Back and forth a few times. Don't have to go super low. Do one more each side. And then stand it back straight. Pick up your foot behind you for a hamstring curl. Stretching out your quads in the front here too. And switch sides. Hold on to something if you need it. And switch. Do each side one more time. Other side. Good job. We'll stretch our shoulders, bring one arm across you, pull it in, hold it here for just a second. And then we'll do the other side. Getting our shoulders, our upper body ready. Good. Let that go. Now that we're all warmed up and ready to go, we'll get into the resistance part of our workout. So we're going to start with side steps in a squat position. So you're just seated just a little bit, and then we'll step it out, step to the same side again, and then go the other way. So we'll do 2 steps in one direction, 2 steps in the other. If you have a loop resistance band at home, you can totally put that on over your thighs. I'm going to do it just body weight today, though. We're going to go for 20 total. So get in that squat position and step one way, step it again, and then back the other way. Good. That's just 5, 6. Stay in that squatted position. 9, 10, 11, 12, 13, 14, 15, 16, 17, 18. Just 2 more the other way. 20. Good. You can stand it up straight. Take a break. We'll do 2 more sets of that. When you're ready, if you put a resistance band on, you can always drop it whenever you're ready. We'll do 2 more sets. So squat position, and then step, step, and then other way, step, step. Good. 5, 6, 7, 8. Your hands are just wherever you feel comfortable. 11, 12. Good job. Just both ways. One more time. 19, 20. Good job. Shake it out a little bit. Just one more set of those. Grab a drink whenever you need one. And then we just do it one more time. Squat position. Step, step. Good job. And other way. 6, 7, 8, 9. Halfway already. And this is our last set of these. 14, 15, 16, 18, 19, and 20. Good job. Take a break. Grab a drink if you need it. We're going to grab our dumbbells for this next exercise. You can keep them lightweight. And this movement's kind of combining 2 things into one. So you're going to get in that squat position again. Whichever side you want to start on, you'll step out. Opposite arm will punch sideways. And then bring it in. So step out, punch, and then back to the middle. Whichever side you want to start on, we'll alternate, and we'll do 20 total, 10 each way. So get down just a slight squat. You don't have to go as deep as we did last time. Step, punch, back to the middle, step, punch. And that was 2. Punch, punch. Good job. 5, 6, 7. This is working our legs, our abs, and our arms all at the same time. A little bit of everything. This is number 11, so we're halfway. Good job. 13, 14, 15. Keep going. 16, 17, 18. One more each way. 19, and 20. Good job. Take it back. Take a break. We got 2 more sets of that. Just make sure when you're punching, you feel a slight twist, but don't twist too far to where you're hurting your lower back. Just a slight twist to where you feel it is perfect. All right. So when we're ready, just a baby squat and step, punch, step, punch. Good job. 3, 4, 5, 6, 7. Good job. Keep going. 8, 9, 10. That's halfway right there. 11, 12, 13. Keep going. 14. Remember, a slight twist. Not too much to where you're hurting your back. 17, 18, 19. Good job. One more. And that's 20. Good job. Take a break. You can always drop your weights whenever you need. You can drop them and then pick them back up. It's your workout, whatever works for you today. And we just got 1 more set of that. So when you're ready, slight squat, whichever side you've been starting on. Step, punch, back to the middle, step, punch. Good job. Keep going. And this is our last set of these. 6, 7, 8, 9, 10. Halfway already. 11, 12. Keep going. 13. If you've made it this far, you can finish it out. 16, 17, 18. One more each way. 19 and 20. Good job. You can drop those weights, grab a drink, take a break as long as you need one. Shake those legs, shake those arms out a little bit. Next, we're going to go into lateral lunges. So we'll have that wide leg stance that we did in the warm-up. We did some shallow lunges. This time we're just going to go a little deeper because this is the resistance part. This isn't our warm-up anymore. So wide leg, whichever side you want to start. Lunge it deep, and then lunge the other way. Just make sure your body's still standing up straight. You're not hunching over. Your top half is straight, just your legs are going down. So whichever side you want to start, we've got 20, 10 each way. So 1, and back to the middle. 2, 3. Remember, slow and controlled for these ones. Still standing straight, not hunching over. Good. 7, 8, 9. This is number 10. This is halfway. If you need to grab onto something, if you don't trust your balance yet, that's okay. 13, 14, 15, 16. This is working our quads, our glutes. Good. One more each way. 19 and 20. Good job. We got 2 more sets of those. Whenever you're ready, take a little break in between. Take a deep breath. And we'll do it all over again. So when you're ready, into that wide leg stance, a little wider than your shoulders. And whichever side you want to start, down and down. Good job. Top half is still straight, not hunching over. Good. We're on number 5, 6, 7. Your hands are just wherever you feel comfortable. You can have them on your legs, above your head, whatever you like. And this is number 12, 13, 14, 15. Good. We're almost there. 16, 17. Keep going. 18. One more each way. 19 and 20. Good job. Bring it up. Just one more set of those. And then we'll give our legs a little break. Mine are screaming. All right. Shake them out. One last set. Back into your wide leg stance. And whichever side you've been starting on, take it down. And now to the other side. Good job. As low as you feel comfortable going while still keeping good form. And that good form is keeping your top half straight. Good. We're on number 7, 8, 9, and 10. That's halfway right there. 11, 12, 13, 14, and 15. Good. We're so close on our last set. 16, 17, 18. One more each way. 19. And this is number 20. Good job. All right, those aren't easy, so pat yourself on the back, grab a drink, and we'll move it to our arms next. So when you're ready, you can grab your dumbbells. We're going to do alternating lateral raises. So you'll pick a side to start on. Only one arm's going to move at a time. You'll bring it up about shoulder height. I like a little bend in my elbows. Just make sure they're not perfectly straight so you're not locked, and that can hurt your elbows. And then bring it down, and then you'll switch to the other side. Remember, just about shoulder height. Make sure you're going slow and controlled, so you're using your muscles, you're not using your momentum. And we'll do 20 total, 10 each side. Let's get started. Whichever side you want to start, bring it up and switch. Good job. Remember, slow and controlled. We're not swinging them, we're lifting them. 6, 7, 8, 9. Good job. 10. We're halfway there. You can always drop your weights halfway through if you need it. It's better to keep doing the motion than just quitting altogether. 15, 16, good job. 17, 18, one more each way. 19, and 20, good job. Take a break, shake those shoulders out. Your feet are just wherever you feel comfortable. I like a slight bend in my knees. If you'd rather stand straight, you can have your feet together, shoulder width, whatever you like. We're focusing on our arms. So we got 2 more sets of that. Whenever you're ready, whatever side you want to start. 1, 2, 3, 4, 5, good job. 6, about shoulder height. 7, slight bend in your elbows. 9, just make sure you're not locking them on the way up. 12, 13, 14, 15, 16, so close. 17, 18, 19, and just one more for 20. Good job. Take a drink, do whatever you need to do. We got one more set of those. I definitely recommend a lighter weight for these. You're probably feeling that by now. All right, we got one more set. Let's go. 1, 2, 3, 4, 5, 6, good job. 7, 8, 9, and 10. That's halfway. 11, 12, 13, 14, so close. 15, 16, 17, 18, home stretch, just one more each side, and that's 20. Good job. Drop your weights, grab a drink if you need it, and when you're ready, you're going to move it to your mat or your floor space, whatever you have. You're going to move to your back. So we'll take it down, and your knees will still be up, be in that hip bridge position. So once you get down here, we're going to do alternating hamstring walkouts. So you're going to start in your hip bridge position, and then whichever foot you want to start with is going to step out and come back in, and then you'll do the other side. Step it out and come back in. Your hips are staying in the air the entire time. We're doing 10 each side, 20 total. We're alternating. So bring it up and step it out and bring it back. Other side, step it out, bring it back. Good job. Keep going. We're on number 4, 5. Remember, hips are up the entire time. Feeling this in our hamstrings. Good job. This is number 9. 10, halfway right there. 11, 12, 13, 14. Good job. Keep going. Hips are still high. 16, 17, 18. One more each side. 19 and 20. Good job. Set those hips down. Take a little break. We've got 2 more sets of those. 20 reps each time. Shake your legs out a little bit, and we'll go back down when you're ready. Your back's flat on the floor. Hips go up. Whichever side you want to start, step it out and bring it back. Other side, step it out and bring it back. 3, 4, 5. Remember, hips are high. Just your hamstrings are moving. Press your shoulder blades into the floor. Good. I'm on number 10, 11, 12, 13. Keep going. 14. This is our last exercise, and then we'll stretch. Good job. I'm on number 18. Just 1 more each side. 19 and 20. Good job. Drop those hips. Stretch it out a little bit. Take a break as long as you need it. Good thing about a video is you can always pause it whenever you feel like you need it. And let's do our last set before we stretch. So when you're ready, hips go up and step and bring it back and step and bring it back. I'm on number 3, 4, 5. Pressing your shoulder blades into the ground, keeping your hips up. 8, 9, 10. Good job. We're halfway there. Keep going. 12, 13, 14, 15. Good job. 16. 2 more each side. We're almost there. 18, 19, and 20. Good job. Drop those hips. When you're ready, you can sit it up. We'll do our cool down on the floor today. So sit however you feel comfortable. Grab a drink if you need one before we stretch. And we'll start with our neck. So we'll start going ear to your shoulder, tilting it slowly. Hold it here for just a second. And then you can switch. Feel that stretch in your neck. Good job. Let's do each way. 1 more time. You never realize how bad your neck needs stretched out until you do it. For me, anyway. Good. Now you can go chin to your chest. Hold it here for a second. And then when you're ready, look towards the ceiling. Remember, slow movements for these. Take it back down. We'll do each way 1 more time. To your chest. And up to the ceiling. Good job. You can bring it back to neutral, and then we'll do some turns. So just turning it side to side. Hold it one way for just a second. And then slowly turn it the other way. We'll go back and forth 2 more times. Slowly so we don't hurt anything. 1 more time each way. Good. Last side. We'll do some side bends, whichever side you want to start with. Pick up your arm, go over. And switch to the other side. You can use your arm that's down to support you. Let's go each way 1 more time. And other side. And back to the middle. We'll do some rotations. So hands behind your head, standing up or sitting up straight and tall, and just rotating your torso. And the other way, nice and slow for these. Don't twist it too far to where it's hurting your back. Just to where you feel a slight stretch. And other way. We'll go through this. We'll do one more. Twist it. And other way. Good job. And now you can relax. You've made it through week 7 of our moderate intensity strength training program. I'll see you next week for week 8.